The basic principle behind Medicare is that the health of a citizen should not depend on their wealth. That was Bob Hawke in 1984, a simple sentence that reshaped this country. Before Medicare, your bank account decided whether you got to see a doctor. If you were sick and didn't have enough money, you went without or racked up debt. Prior to the introduction of Medicare, medical costs were the leading cause of bankruptcy. My mum still talks about it. She remembers borrowing money from friends and family just to take us to the GP. There were choices no one had to make, so no one should have to make, between groceries and medicine, rent and a diagnosis, one child's treatment over another. Then came Medicare, introduced by a Labor government with a simple belief: healthcare should be universal. That being able to see a doctor or get treatment in a hospital shouldn't depend on your income, your postcode, or your private health insurance status. Healthcare shouldn't be a privilege, it should be a right. It's hard to overstate what a difference it has made. People got the care they needed when they needed it, and for the first time in our country's history, health became something the system helped with, not something it punished you for needing. But let's be clear, Medicare didn't survive this long by accident. Every step forward has come from Labor governments, and every attack, every freeze, every cut has come from the other side. In my community of Leppington, we're seeing the difference a government that genuinely believes in public health can make. Labor has introduced urgent care clinics. These care clinics are open 7 days a week, operating with extended hours and a fully bulk billed. You don't need to wait hours in an emergency department for a minor fracture, an infection, or a sick child. And you definitely don't need to pull out your wallet. 3 of these clinics are already up and running in my region, in Fairfield, Liverpool, and Campbelltown. They're giving people faster care, easing pressure on our hospitals, reducing wait times, and helping emergency departments focus on life-threatening cases. And I've seen the difference firsthand. Just last month, my mother-in-law had a heart issue. My wife took her to the Fairfield Urgent Care Clinic, where she was seen immediately and got the treatment she needed and deserved. Then, the weekend before last, my daughter injured her ankle. We took her to the Liverpool Urgent Care Clinic. In the past, this would have meant a long wait at the Liverpool Hospital Emergency Department, one of the busiest in the country. These clinics are making a difference, not just for my family, but for millions of families right across Australia. And more on the way with a new clinic planned for the Green Valley area. This is the work of a government that believes in public health, not just in words, but in funding, access, and outcomes. Strengthening Medicare, lowering out-of-pocket costs, building services close to where people actually live. The alternative? Funding freezes, bulk billing incentives slashed, talks of co-payments and user pays, shifting more of the burden onto hard-working families. We've seen it before, Speaker, and every time it takes us further away from the Medicare that Australians rely on and closer to an American-style healthcare system. A system where your ability to get care depends on your insurance card, where one accident can mean hundreds of thousands of dollars of debt, where health is a product, not a right. We can't let that happen here. To go back to a time when people delayed going to the doctor because they simply couldn't afford it, when people were forced to choose between their health and their bills. Medicare didn't just happen. It was built, piece by piece, clinic by clinic, reform by reform, by the Australian Labor Party. Labor made Medicare, Labor strengthened it, and Labor will keep fighting for it because the job's not done. The question in this upcoming federal election is simple. Do we want a healthcare system that treats you when you're sick, or one that asks if you can afford it first? I know where I stand.